Hello, everyone, and welcome to Autism Stories, where we connect you with amazing people that help autistic adults and teens to become more successful. I'm your host, Doug Bletcher, the founder of Autism Personal Coach. In the last year or so, we have seen an increase in the number of our clients that have Ehlers-Danlos syndrome and the impact that it has on one's life. However, what is Ehlers-Danlos syndrome and what can this teach us about autism? We discuss this and much more with Emily Casanova, Research Assistant Professor with the University of South Carolina Medical School at Greenville. We hope you enjoyed today's conversation. Emily, thanks so much for joining us today. Now, you are currently a Research Assistant Professor with the University of South Carolina Medical School at Greenville, with one of your focus areas on autism. What brought your focus to this particular area?
Oh gosh, well it was some time ago during my undergraduate career, and I took a part-time job as an ABA therapist for First Steps of Missouri, and at that rate you don't you don't need an excessive amount of training to work with the really young kiddos. And so that kind of started me off, and I started reading some literature on the topic, and also kind of realized that I was spectruming myself. And so both of those things kind of, got me a lot more into, the study of autism. And at the time being a psych major, I was not yet pointed in the direction of research, but truthfully, my interest in autism kind of veered me that way. So really, I am a researcher because of autism rather than the other way around.
Now, another area of yours that some of our listeners may not be too familiar with is Ehlers-Danlos syndrome. Can you share for those that may not be aware what this condition involves?
Right, yeah. So Ehlers-Danlos syndrome, I should say syndromes, it's currently a collection of 13 different conditions. And the most common type now is known as hypermobile Ehlers-Danlos syndrome. And that makes up probably about 80 to 90% of the whole Ehlers-Danlos population. There's unfortunately no really good current prevalence rates. That's something that we're in dire need of. But considering that the criteria for Ehlers-Danlos has changed considerably just within the last 2 years, obviously there's kind of a shifting diagnostic. The basic thing that people have probably recognized if they've heard of something like joint hypermobility syndrome, that has very close ties with Ehlers-Danlos, and in general it's believed to kind of be on a spectrum with that hypermobile form of EDS. And nowadays, joint hypermobility syndrome is called hypermobility spectrum disorders, or if the individual really isn't experiencing a lot of impairment, physical impairment because of the condition, then it's usually just termed asymptomatic joint hypermobility. But ultimately, one of the major criteria, as you can probably glean, is basically joint hypermobility or double jointedness, and usually it requires something called generalized joint hypermobility. So a certain number of joints need to be affected in order to kind of make cutoff. But then when we're talking about hypermobile EDS in particular, there's some other features as well that are now part of the new criteria, the 2017 criteria, and that talks about other kinds of features of the connective tissue, which of course lends towards this hypermobility, but also tends to affect the skin in certain ways, and healing, and just other features that are related to connective tissue that kind of holds the body together. And ultimately, we don't know how common or rare it is. It's believed that the hypermobile form of EDS is fairly common, but sadly we just don't have numbers right now. We do know that probably about 2% of the population in general has some kind of hypermobility spectrum disorder that has generalized hypermobility and some kind of pain and impairment. So that's actually fairly common. Yeah, it's still a growing area of research, and hopefully we'll have some of those answers over the next coming years because there's a lot of need for it.
Now, through Autism Personal Coach and our coaching, we're seeing some of the people that we work with who have Ehlers-Danlos syndrome. What is the scientific research out there saying in regards to this connection?
Sadly, the research at the moment is kind of sparse. Most of the data that we have at present is more anecdotal. As I said, we don't really have prevalence rates for Ehlers-Danlos, period, and we definitely don't really have prevalence rates as far as how frequently it's overlapping with autism. From knowing the patient community intimately, the Ehlers-Danlos community, it does appear that autism or the broader autism phenotype is pretty common in this population. If I had to guesstimate, and don't quote me on this, but I would say probably a good 10% maybe of the Ehlers-Danlos population also has a diagnosis of autism or would meet current criteria. And then my guess would be probably roughly another 20% would fall in that broader autism phenotype. But again, it's early days. There's also some problems with the fact that a lot of the individuals with Ehlers-Danlos, of course, they're usually not cognitively impaired, all right, so they don't have any kind of diagnosis of intellectual disability. And as we all tend to know, kind of the higher up that ladder you get in terms of cognitive ability, autism tends to be harder to diagnose and doesn't always conform to the gold standard research ADOS version. So again, I suspect probably a number of individuals are going to be missed that do kind of fall along that autism spectrum. It's kind of hard to tell at the moment. But yeah, we are definitely seeing some significant overlap. I'm seeing it in our research study, one of our research studies that we're doing right now, a clinical study, and I'm working with moms of kiddos with either autism or ADHD, and so I'm definitely seeing some very EDS familiar features in some of these moms who many times themselves are on the spectrum or pretty darn close to it. So I think over the next few years, maybe five years or so, I think we should have some good numbers, I hope, and get a better handle on how frequently these two spectrum conditions are co-occurring. So, and we're seeing it a lot in family too. It's not always necessarily the individual with EDS who also has autism, but it may be a family member who has autism. So it kind of pops up in different versions across different family members.
Now, recently you wrote a wonderful article about what Ehlers-Danlos syndrome can teach us about autism, and you discussed how ED and autism could be connected based on collagen. How does collagen have such an important role in this possible connection?
Well, I should first off that we don't necessarily know that the hypermobile form of Ehlers-Danlos is definitely a collagen-based condition at its root. That's kind of an assumption that many of the other forms, the rarer forms of Ehlers-Danlos, often have mutations in collagen-related genes. But at present, we don't know that is definitely the case because hypermobile EDS is probably more common and in such greater number usually that indicates that it's more of a complex type of condition, sort of like autism. So that there's probably it's probably pretty heterogeneous in terms of any kind of genetics that may underlie it. And so I should just say that first and foremost, that's kind of how I come at it. I come at it as I've learned to come at autism. Autism occurs in many different shapes and forms and across many different types of people. And for those who do have some kind of genetic component to their autism that is clear and definable, I should say, it's highly variable. And so the common denominator ultimately is kind of the brain and behavior kind of funnels through into a particular type of syndrome or group of behaviors. So I look at Ehlers-Danlos rather like that even though we're not really focusing on the brain in this case per se, it still probably holds number of different conditions that are funneling into a common set of symptoms. And so with that, yes, it's probably affecting collagen somehow, and how that's overlapping and potentially increasing the likelihood of autism, that's difficult to say at this point because there's just been so little work. At the moment, we do know that they overlap. We have a little bit of idea of what may be going on with Ehlers-Danlos, but it's still kind of hypothetical at the moment. But as far as a few possibilities, if collagen is definitely affected and is kind of the, shall I say, culprit in this instance, for want of a better word, and we're talking about brain development, well, collagen, although it's not very well studied, is definitely important for brain development. And it kind of acts like a scaffold for the developing brain. And so, obviously, if you affect collagen, that could potentially alter brain development in some way. The other alternative that I'm particularly interested in is that a lot of people with Ehlers-Danlos syndrome often have immune disorders. And so we already know that the maternal immune system can potentially play a role in the development of autism in the child. And so we're looking, I'm more interested really in what the mother's immune system may be doing to influence whether or not that child goes on to have traits of autism or not. But again, there may be other alternatives as well. It's kind of an open field at the moment, but there's a few promising avenues of potential research, I think, in terms of how these hereditary connective tissue disorders, which is a large group of conditions, of which Ehlers-Danlos is just one, or I should say 13 rather, how they may influence brain development. And Ehlers-Danlos is definitely not alone. There are definitely some, should I say, probably whisperings of other hereditary connective tissue disorders and their links with autism, such as Loeys-Dietz syndrome, which is a more severe syndrome and can have severe heart effects, unfortunately, as well as Marfan syndrome. But again, those aren't especially well studied, but there are a number of case studies out in the literature and some small studies. But, so it's still early days, unfortunately, but I think that's also exciting because we have some potential avenues to continue to look into in order to better understand, why are these co-occurring, and then how can our understanding of the biology of Ehlers-Danlos better help us to understand the biology of some types of autism within certain families.
Now, starting in 2016, you and some of your colleagues started to look at the connection of ED and autism by conducting some different surveys. I know one of the surveys had over 700 people respond. Were there any surprises that resulted from these responses?
Yeah, I think probably some of the most surprising for me, which I really wasn't looking for at the time, and of course now I am, but was that there was a surprising number of mothers with Ehlers-Danlos who reported having autistic kids. And in the population that we surveyed, it was about 20%. Granted, that's not a definitive prevalence rate. We would need to actually go in and look at like clinics that are serving Ehlers-Danlos populations and get a better idea of how frequently moms within those populations have autistic kiddos. But because there's always potential bias with surveys, of course. But that was a huge number, and actually it was no different than the rate that we saw of autistic moms reporting having autistic kids. Both of them, about 1/5 of them, had autistic kids. So that was pretty huge to us, and is really pointing towards an area of research that I think is exciting, and that I think I really wish more researchers would get into studying that overlap, especially as these conditions can be, in terms of Ehlers-Danlos and the hypermobility spectrum disorders, they can really be impairing. I'm also a patient. I'm not just a researcher, and I can vouch for the impairment. It's a challenge, Although I am one of the lucky ones who's still capable of working, thankfully, so I really do feel like it's kind of my joy and my responsibility to really try and figure this out. That because there are a lot of people out there suffering who may be bedridden, etc. But anyways, yeah, so that was a really exciting finding, and I think it holds a lot of great potential. The other thing that we found was that when EDS moms, the ones who had autistic kids, they tended to report more immune problems. And so, again, that kind of sparked my interest in some of the influences that the maternal immune system in Ehlers-Danlos may potentially be influencing the likelihood of autism in the child. So, again, that it's early days, and that was a self-reported survey study. So, that's something we really are hoping at some point to follow up clinically to really confirm whether that is indeed the case. But yeah, both of those results in particular were very exciting to me, and I think hold some promise in terms of research. So.
And you mentioned that there's been a lack of research regarding this connection. Why do you think there has been so little research trying to find out what the connection between EDS and autism is?
I would say first and foremost, it's a lack of communication. The research community tends to be very removed from individuals with a given condition, whether that's autism or Ehlers-Danlos. And so it was simply by me having been a patient myself and integrating into the patient community did I really start hearing a lot about autism. And as an autism researcher, I thought, well, wow, this is a great area for me to research because really hardly anybody's doing this. So it's unfortunate. I can understand why. For instance, some of these patient groups, like their Facebook groups, they're closed to people if you don't have the condition or suspect you have the condition. So of course, there's kind of a boundary there. But in general, I think it's just kind of status quo for researchers not to interact too much with the group of people that they're studying, or to, even if they do in terms of clinical studies, they don't really get to, just socialize with them too much and just kind of have a nice sit down and say, what are the things that are bothering you most and how can I help? I see that as probably the biggest barrier as to why Ehlers-Danlos and autism, why that overlap has not been studied earlier than this, simply because of that division between researchers and individuals with the condition. There is a growing number of patient scientists, thankfully, within the Ehlers-Danlos and hypermobility spectrum disorder community. So I'm looking forward to continuing to see more research coming out of those laboratories because I think in general they're kind of right on gear in terms of what patients are wanting to see in research. And I hope I'm also kind of addressing that. I know I'm not necessarily addressing issues that affect impairment, and somebody's ability to get out and enjoy themselves in a day-to-day life, that sort of thing. I'm a little bit more focused in terms of the neurodevelopmental aspects, but that's where my experience lies, and I feel like that's where I can best help people too. Yeah, that's how I see it. I'm really hoping that the scientific community will start to see that this overlap, I think, is very significant, and this may be influencing a lot of the individuals that they're trying to treat or study. And so in order to try and help that, I have applied, I've submitted an application for a special interest group at INSAR 2020, which is the major autism research conference that occurs each year in May. And I have invited a number of scientists, but I'm also inviting a lot of the individuals with these conditions who fall on both of these spectrums so that they can talk as well. And I'm really hoping that can start communication. and that may spur on a few of these other laboratories to start looking into this overlap because, I mean, there's so many potential areas to study. The few people who are kind of looking at these areas, there's not enough of us. We really need more scientists to take part in this. So, and I think it's just a really promising area. I really am seeing a spectrum of hypermobility, for instance, with the moms that I'm seeing. And, these moms in general, we're finding are more impaired physically. They have more health problems than their ADHD mom counterparts. And, and they are more likely to have significant pain associated with their hypermobility. Again, this is kind of they're just kind of, silently suffering, these families, in terms of pain and inflammation and impairment. And I think this is something that I'm sure is also, affecting the autism spectrum itself, particularly women. A lot of these conditions, especially the hypermobile Ehlers-Danlos form, is almost predominantly women. So it's a little bit, in some ways, the opposite of autism, where you may see more males that are more obvious or more frequently diagnosed. But with EDS, it's women, and not exactly certain why, but probably the way that estrogen influences the stability of connective tissue, and that for males with testosterone, there's just kind of a protective effect. So even if they're kind of, for want of a better word, carriers of a connective tissue disorder, they may be less obvious and go under the radar. Anyways, so I'm really hoping that at INSAR this coming year, that we'll have some good attendance for that special interest group, which will unfortunately probably be at about 7 in the morning. So it does take a little dedication if you're wanting to attend. But but I really do encourage anyone on the spectrum, or families, any scientists who are attending INSAR, to join into that special interest group, because we really want to do a good brainstorming session on how to improve interest in this area, which I see a lot of people with these conditions are really calling for, and we just haven't met that need yet. So I hope we can start to do that.
Now, I know you've taken things a step further beyond these surveys, you're now conducting your first clinical study on the possible connection between autism and Ehlers-Danlos syndromes. How is the study going, and is it too early, or do you have any initial results from this study?
Yeah, the study that you're referring to is the one where I'm looking at moms of kiddos with either autism or ADHD, or both. And as I said, we're seeing that these moms are a lot more impaired physically and medically, and that many of them have subtler features of Ehlers-Danlos. We have had a couple of individuals in our study who have gone on to get an Ehlers-Danlos diagnosis because of our study, referred them on to genetic counseling afterwards. Yeah, we're very excited about this. It's a small study currently, and we're hoping to expand. It's kind of a preliminary study. But we are seeing some potentially significant differences between these two mom populations. So yeah, we're looking forward to continuing to kind of tease that apart. We're also starting a study looking at overlap between Ehlers-Danlos and Fragile X premutation carriers, in part because we're also starting to notice that there's a number of premutation carriers who have had either previous diagnoses of hypermobile Ehlers-Danlos before, for instance, they had a child that was diagnosed with Fragile X, and then they were diagnosed as a premutation carrier. And it was previously recognized in the literature that premutation carriers and people with Fragile X do have some features of hereditary connective tissue disorders. It's just that we haven't realized until now how significant that was, and that there may actually be a subset of individuals with a diagnosis of hypermobile Ehlers-Danlos syndrome who may actually be premutation carriers instead. And so we've got a paper that we are submitting soon, a series of case studies. Hopefully that will be coming out in the next however many months, sometime this spring, I'm hoping. We've done a little work on that paper. We're collaborating with some folks at the Mind Institute, Dr. Rhonda Hagerman, who runs the Fragile X clinic there. So we're really hoping that also this will kind of open up additional interest in terms of hereditary connective tissue disorders and autism, because obviously there's a big link between Fragile X and autism. That's definitely one thing that we hope that clinicians will start testing for when they have somebody who comes to them who has some kind of hypermobile spectrum-like disorder or something that really does genuinely look like Ehlers-Danlos syndrome, that they at least try to rule out that it's not Fragile X premutation, which is something important because Fragile X premutation in terms of the female population occurs in about 1 in 150 women, and that's a lot. So it's actually quite common. And the majority of individuals are probably not diagnosed because most of them usually only get diagnosed if someone in their close family has a diagnosis of Fragile X syndrome. Usually that's the only way that they ever get diagnosed. So probably at most maybe perhaps 1/10 of individuals with premutation or even less may actually get a diagnosis and never realize that they're premutation carriers. But of course, with that premutation comes potential risk for developing this kind of Ehlers-Danlos-like phenotype. And it doesn't happen in all individuals with premutation, but we're certainly seeing it in some. And we're seeing some individuals who meet criteria for Ehlers-Danlos syndrome with flying colors, with the exception that there's an exclusion criteria where you can't have another connective tissue disorder. But if you didn't know they were premutation carriers, they would be walking out with an Ehlers-Danlos diagnosis. So anyways, we've got a few good things going on, and, very promising, and I'm looking forward to hopefully extending these to some larger, more intricate studies, where we can really start teasing things apart even more.
Now, for our listeners that think that they could possibly have Ehlers-Danlos syndrome, or maybe someone that they know, what are some signs or symptoms that they should look for?
Yeah. So traditionally, hypermobility or double jointedness is one of the easiest features probably to identify or to notice. And I will say that most of the people that I won't say diagnosed with joint hypermobility, but most of them were not aware that they even had generalized joint hypermobility. You don't have to, have bent yourself into a pretzel in order to have, to be double jointed. And so, typically the criteria that's used to diagnose generalized joint hypermobility clinically is the Beighton criteria. That's spelled Beighton. And there's a lot of things online that'll show that, diagrammatically that can show an individual what are the different things that typically the physician might look for. The other thing is some kind of chronic pain or impairment or instability of joints. Are there, kind of chronic dislocations or also subluxations, which is a more minor dislocation where the joint kind of pops out and goes back in on its own. I would say anybody who has chronic issues with pain, could be a potential candidate for looking more into that. It could possibly be something like fibromyalgia, of course, which is primarily muscle pain. But if it's something that's centering around the joints, that's definitely something to potentially look into. Also to rule out that it's not some kind of autoimmune disorder as well, which are more common also in these conditions, just because immune disorders are more common in general. So, in general, there's not a lot of folks out there who are really familiar with how to do this diagnostic assessment, unfortunately. I hope that changes over time. It would be great at some point if, primary care physicians could get a little training and learn how to, do this just in their clinic, because it's not a super difficult assessment. with the exception of course, of having to send somebody to get an echocardiogram just to make sure that they don't have any heart issues. But otherwise, everything else, can be done really just by experience and as well as the goniometer, which allows you to measure angles of joints. I'm a firm believer of always using a goniometer and not eyeballing things. Oftentimes people will try to get in with a genetics clinic. That's probably one of the best places in general to try, primarily because they are already usually well familiar with how to do these sorts of physical measurements. They're doing many of these things with other rare conditions anyway, so that's kind of the group of physicians that are going to be probably most experienced with how to do this kind of assessment. Whether they want to send you on for genetic testing as well, I think that's always a good idea to rule out more serious stuff like vascular Ehlers-Danlos syndrome. And also, too, in the case that we're talking about with Fragile X pre-mutation, that's something else that may be good to rule out, although currently is not an accepted part of the genetic panel for Ehlers-Danlos, so don't be surprised if a geneticist looks at you cross-eyed and like you've grown another head. But hopefully in the coming years that may start to be a little bit more common, because I think we've got some good data that suggests this should at least be a good rule out for folks who have an Ehlers-Danlos-like phenotype, or even just hypermobile spectrum disorder phenotype. I'm a big proponent of going for the genetics clinics. Sadly, a number of the clinics have started to refuse accepting Ehlers-Danlos and hypermobile spectrum disorder referrals, primarily because there's so many of us, and there's also a little bit of ill will, I would say, because there's no agreed upon genetic component. So sadly, I think Ehlers-Danlos sometimes gets treated a little bit like chronic fatigue syndrome used to be treated more, and is almost kind of treated like a psychogenic condition, of course, which it's not. So, yeah, I hope, as we continue to learn more about the variable genetics that probably underlies this very complex group of conditions known as hypermobile Ehlers-Danlos syndrome, I hope that will start to change and that we'll see more, again, willingness from genetic centers to do additional testing and to take this condition a little bit more serious once more. I'm not a big fan of rheumatologists in general. Not that they're all, they're not all bad. There's some fantastic rheumatologists who can definitely do an Ehlers-Danlos assessment. But in general, I've noticed that the field as a whole tends to take a very negative view of the condition and is kind of patronizing. So I would just say be cautious. If you don't have a choice, there's not much else you can do. But if you have a choice to choose between a rheumatologist or, for instance, a geneticist or something, I would probably go with the latter. So people are also welcome to contact me by email. Got my scienceoveracuppa@gmail.com where they can reach me, and I'm always happy to answer questions and give a little guidance. So they're always welcome to do that as well.
And talking about guidance, if someone does have Ehlers-Danlos, what are some strategies or guidance you have for them that may be helpful in dealing with the challenges of the syndrome?
That's really variable. Some people like myself may be relatively minimally impaired and can deal with things with a variety of medications in terms of relieving inflammation and pain, and trying to maintain some form of cardiovascular exercise. But there are just some folks that are so severely affected that's just not going to be reasonable, especially in terms of the exercise. There are some folks that do end up in wheelchairs and need other types of mobility devices, and trying to push through the pain is not a good thing, especially with somebody who probably is going to be having issues with chronic inflammation. Pain just tends to kind of have a snowball effect on inflammation. Unfortunately, individuals with Ehlers-Danlos often have dysautonomias or autonomic disorders, stuff like postural orthostatic tachycardia syndrome or POTS, or also orthostatic hypotension. Both of those actually usually do a little bit better with exercise, particularly cardiovascular exercise. So it's really hard. Some of the treatments are contradicting. So I personally feel better when I'm able to do my regular cardiovascular exercise, but there are definitely days where I can't do that and I feel too horrible, and you just kind of have to wait it out. But Ehlers-Danlos in general has a lot of different problems that come with it. It's not just pain and inflammation. It's almost like if anything can go wrong, it will go wrong. And I generally have a saying that if it's weird, it'll happen in Ehlers-Danlos, and it happens frequently. That unfortunately can lead to a lot of ER visits, and then also a lot of PTSD, because many times if it's weird, the person, the doc at the ER is not necessarily going to give you the treatment that you need and may even cause a certain amount of psychological trauma. That's extremely common. And also, unfortunately, being that this tends to be more of a female-dominated condition, there are biases in the medical field as well in terms of female-associated conditions and pain, and just an implication that often these things are psychogenic and it's all coming from the brain, and that's definitely not the case. So, but sadly, they're treated that way. I don't have a good one-size-fits-all, because every person's condition can be so unique. What may be disabling for one person may not be too bad for another. So it really just varies. I highly recommend for anybody who thinks that they may be on this Ehlers-Danlos spectrum to try to get in with some of the online patient groups, such as with Facebook. I found them especially helpful. There's a huge wealth of knowledge, and many times they're more helpful than the doctors. Although I won't say avoid doctors entirely. There are obviously certain things you definitely need to see a physician for, and don't just trust the Google. But there's a lot of practical approaches that folks in these communities have learned how to do, and they sometimes they can be extremely helpful, so that you don't essentially have to reinvent the wheel all over. So I highly recommend getting in with the online community. There's also a good community on Twitter. If you just hashtag Ehlers-Danlos syndrome, no hyphens, there's a lot of folks there that are talking about their condition and asking for advice or giving advice. So that's another great resource. And, just in general, the patient community is awesome. And we all kind of go through it together. So it's definitely a wonderful social support as well, which I think is vital for anyone who just is suffering with physical pain. It can be draining and it can be stressful. And with a chronic condition, a lot of times, even your close family members may not really understand. Having other people to talk to who really are going through many of the same things that you may be going through can be a really phenomenal social support, and that is just so vital just for one's own mental well-being, because that really underlies our physical well-being as well. So that would be my main recommendation. But otherwise, there's just so many different things that can go wrong with Ehlers-Danlos and hypermobile spectrum disorders, and you kind of band-aid everything. You take each symptom as it comes. But the patient community can help with figuring out what band-aids may actually be useful for you.
And I'd echo that suggestion about the Facebook groups, because I've known a couple of people that have been a part of those groups that had specific questions, and they were able to get some good feedback that really helped them.
Definitely. Most definitely.
Well, Emily, I really thank you for your time today. It was a great conversation.
No, my pleasure. And like I said, if anybody has more questions, they're always welcome to find me with my Gmail. You can also follow my blog as well, which is Science Over a Cuppa. You can find my email through there as well. There are some Ehlers-Danlos related and autism related articles on that blog. But also, too, if I ever have any new studies that are coming out, like any new papers, or if I'm advertising for any kind of online studies, I will also do it through that blog, so it may be a good idea to follow that as well and kind of keep up with that. I don't post super frequently, maybe about once a month, but every once in a while I will put something up about our current work. And if you're interested in following, that's a good place to keep up with it.
Thank you for listening to today's episode, and thanks so much to Emily for the conversation. The connection between EDS and autism is so important because both are very similar in that the challenges aren't able to be seen by the naked eye. To get the support that autistic people that also have EDS need to have a better quality of life is essential. And I was thrilled to end this year with such an interview with the intent to bring this to light. Modern life can be challenging for anyone. When you're autistic, the world isn't designed with your unique traits in mind, and everyday demands can feel insurmountable. At Autism Personal Coach, we celebrate neurodiversity by empowering adults and teens to be the best version of their authentic selves. The people we serve are the real experts. We're here to help their goals become a reality. To get an autism coach for a loved one or yourself, you can contact us at autismpersonalcoach@yahoo.com or call 216-336-5889 and request a coach today. On the next episode of Autism Stories, we will talk with Chris Hall about his business, Computers for the Autistic Foundation. Talk to you then.
Social skill issues, verbal and nonverbal, repetitive behavior, all signs of ASD, easily angered, easily confused, hard to comprehend. What is being said? Standing in line, swaying back and forth. People stare at us like we are fools. Getting real nervous, talking a lot, getting real fidgety. We need some distractions. Who am I? I'm a human too. I'm just like you with ASD. Who am I? I'm a human too. I'm just like you